what you're hearing is a magnet going back and forth inside this device here, and it's hitting a piece of metal basically on the other side, creating a force wave, okay? So there's no actual tapping on Madison's skin directly.
I'm gonna give you a little bit of live juice here. I'm gonna hit the stop button, and I'm gonna take it down.
It's such a sensitive tissue.
So, up or down intensity for you?
I'm going to go up a little bit. Feel that? That's good right there. That's probably like parts of it 3, 4, parts of it 5, 6. So that's pretty good right there.
Okay. If there's any tender spots, you let me know.
You're on one right now.
Oh, cool.
And if you take that one and go side by side, you're going to feel that ropiness that you felt when we were...
When I was down low? Down here, like
right,
this
like
thing?
That. Yep, exactly. Exactly. Oh, yeah.
Some people say when you press on it, you get like referred pain down your arm. Do you get any of that, or no?
So that's...
Or it just depends on where it's at?
Like right now, it's just local, right? But you can get that, and that's sort of one of the definitions of a true active trigger point, right? Yeah, see that's really, that's where the spot is up there. Because that takes it up to that 6th level. And it's not unbearable, but it's certainly uncomfortable, right?
Yeah. It just likes to slip off your tendon, honestly.
Yep.
If you're not putting any pressure on it, it'll just slide off because of how tight it is.
Yeah, see, that's the most sensitive spot you found right there.
You can see your muscle.
I just got that on camera.
What'd you see?
It's like...
The muscle was like...
It's fasciculating, So this is more like for a trigger point right now, right? Yeah.
Because it's not doing it anymore. Yeah. But...
There it goes. Damn.
Yeah, that's this focal spot right there, Katie.
Yeah. I move it around at all, or is it all just?
Oh, it's yeah. This is you're like right on it right now. That's like that takes that to a little bit more than a 6, right?
Which is all
but not so uncomfortable that I want to get away from you, right?
Yeah, but it's not like
Yeah.
You want to make sure you're feeling something. It's not like because then it's really not really doing anything.
And then now you sort of no, you're still on.
You're still
you're still on it. Yeah.
The whole thing.
That's awesome. Okay.
I'm gonna give you a little bit of live juice here. I'm gonna hit the stop button, and I'm gonna take it down.
It's such a sensitive tissue. It's so superficial like that. Oh yeah, go ahead.
So Dr. Warren, I am now on the lowest possible bar.
You're good.
I'm at 0.3 bar.
That's wild, yeah. It's very diagnostic. That's actually fine.
Are you okay with that?
It's what I love about this tool so much is like you're gonna roll over different areas, and then you're gonna get to the point of the capsule where I'm feeling the most disturbance, which is right north, right there, and you just get to find exactly where, and you can kind of travel around because I'm gonna cry if I have to get my own stick. You can find exactly where the person's tissue irritation is. It just really laser focuses in on it. That's not too bad. I can tolerate that for a session.
Okay. Well, then this is where we'll stay.
Yeah. So what we like to say to people is like a 4 out of 10 intensity. To me, that's probably like a 6, 7 out of 10 intensity. When it gets right there, wow, what a wild feeling that is. You know what it reminds me of? It reminds me of like when you get dry needle right in the area of like the most sensitive tissue. You know what I mean?
I do know what you mean.
What's nice about it is like you get a lot of shots to really focus in on that problem area.
Right. So I know the desired effect is happening. I can see a little bit of blanching here, which lets me know that there is blood moving to this tissue.
Yep.
It's great. Just gonna challenge the capsule right there.
Wow, that's so wild.
So the only thing about the Shockwave is recommended, Dr. Warren, for at least another 6 days. Please don't do anything too ballistic in nature. You're free to exercise, but I don't recommend you trying to set a vertical record. Maybe avoid sprinting, things of that nature. Yeah, it's very superficial, and you're taking it like a champ. I'm impressed.
Oh, thanks, man. Making me feel better about going down below the half bar.
It almost doesn't register on this machine, but
God bless.
home stretch, 290 pulses.
Man, our patients are so much tougher than me.
Everybody is tougher than me. Literally everybody.
Oh man, that's so funny.
Nice.
Yeah, right there is a wild deep ache that I feel through the joint line. And it's like you just hit the injury over and over again. Nicely. Thanks.
So Christian, I'm going to get started right through here, okay? Let me know if it's ever too intense.
You got it.
So just like the dry needling and the soft tissue work that I've done here, I'm getting into Christian's hamstring group. I'll do medial and lateral, and then I'll kind of work it down into that gastroc and soleus. Good intensity for you there, Christian?
Great.
Bella, last year you told me that I was going to be Tinkerbell for Halloween.
Are you gonna?
I'm
really
not
gonna do
busting
it?
out this year.
I want to see you in a Tinkerbell costume. What are you gonna be for Halloween this year?
A Ninja Turtle.
Oh wait.
Yeah.
As we kind of go about here, we're going to start very mild, and you're going to feel this right about now. Okay, how's that so far? Good. So I'm going to be gradually turning up the intensity as we go. And if you feel like there at any point is like a particularly hot spot or a trigger point, let me know, because we can spend some more time on it and really kind of melt it down. Right around here. Focus in.
Further down.
Further down. Yeah.
Yeah.
How's the intensity?
It's good.
Yeah. Like you say you're at around the sort of 4 or 5.
Yeah.
Okay. So we'll keep you here. And like we were saying, the Shockwave is really effective at just breaking up stuck areas. Chronic issues in particular that are just stubborn to other treatment modalities. The Shockwave's been. We've been seeing a lot of patients with a lot of great success with it. So, yeah, hopefully we'll give you some relief with this issue and just feeling better. How long has this issue been affecting you?
Probably a year or so.
A year or so.
It's not always an issue, like it gets stuck. It flares up every once in a while.
Okay. And is it more or less a product of just work and
I think so, yeah.
posture, work postures?
Yes.
Yeah. Have you ever messed with like the ergonomic devices,
I have an
the
ergonomic
keyboards,
mouse. I do have a mouse.
Okay. Nice. Standing desk and all that good stuff.
I don't have that. I have to buy one of those things that goes on top of the desk.
Okay.
What you're hearing is a magnet going back and forth inside this device here, and it's hitting a piece of metal basically on the other side, creating a force wave. Okay, so there's no actual tapping on Madison's skin directly, but she'll feel a sensation like there is tapping due to the force coming through that metal. I like this tool a lot because as somebody that practices manually, like right there, dude, So I'm following that line of tension, and the reason I like it is that I can kind of sink into a trigger point like that and come off of it. But I can find some of the areas where there's irritation to the tissue, if you will, right? And so it can be intense in some areas, especially where you've got a lot of inflammation or just stress to the tissue. And I'll pick that up through palpation, through...
Cool with that?
Yeah. Alright, I'm gonna slowly turn up the intensity of it. I want the intensity of it should float between 4 and 6 out of 10.
Okay.
So you let me know when it gets there. Where do you say you're sitting at right now?
3 or 4.
3 or 4. How about now?
5.
5? Okay. Any spot in particular more sore when I go over it?
Kind of the lower central.
More through here?
Yeah. Right.
Is that really where you feel the pain when you take stairs?
Yeah.
Okay. So if I hang out here, what would you give it?
6, 7.
Cool. I'm gonna hang out there then. So what Shockwave is aiming to do is we're kind of disrupting some of the tissue in this area that might have healed poorly and giving it a chance to be better the second time around. And that alleviates a lot of pain. Yeah, that's a spot. How long has this been going on?
A couple years to be honest. Real low level, but just noticeable.
Do you have any history of significant injury to this area? Nothing. That's a good thing. Doing okay with that still?
Yeah.
Is it still about a 6 or 7 out of 10, or did it back off a little bit?
I'd say more like 5, 6.
So that's pretty common. Once we focus on an area for a little bit, then we start to move the head around a little bit and go back to the area. A lot of times patients will say it feels a little bit more tolerable. That's what we're looking for.
So we're just mainly coming around. We don't want to go over top of any bone, so we're just sitting right here in the muscle. We can even go a little bit lower, but again, we only really, see, we just found a good spot there. We only want to go to spots that have gel on them though, and that's really important. So always apply extra gel. You can always just take a towel and wipe it off, but if it starts feeling like there's rubber bands kind of snapping against the skin, then you don't have enough gel on the skin itself. And that's just going to lead to discomfort during the treatment. How does that feel, Bella?
Good.
Perfect. So let me know if we hit any tight. Is that a spot right there? All right. Right as I was saying it, we found a good one. And so it's harder to tell because Bella has her face down, but you always want to look for, a little flinching or anybody trying to grimace and make a face. That's when you know we've gotten a good spot to sit on here. Now what we're doing is we're coming in and using acoustic sound waves to basically cause micro traumas on the muscle itself to kind of jumpstart the healing process, and any cells in the muscle that are dying off or are weak or really just have no reason to be there anymore, we're going to actually kill those off, so that way the body can go ahead and start the healing a little bit faster and start getting some new fresh cells into that muscle.
I thought it was gonna hurt, but it doesn't.
No, it doesn't hurt too bad unless you have a really troublesome spot, and then it'll scream at you a little bit.
But kind of just moving it around, getting the tissue ready for the other radial pulse. We did do
So are you doing radio pulse after?
Yeah. So vibration first gets this the part of the body ready for like the other like shocking vibration part of it. And then radio pulse comes after. Is all that okay? And as she gets used to the feeling, we'll kind of increase it a little bit. So we just keep going. And then you let me know if there's any spots that you can feel a little bit more than others, okay? Am I in the general area?
Yeah. Does it hurt?
No. You try not to go over it, but sometimes when you don't find this spot, like with her, she's not really giving me like a direct, like direction to go in. So like, there's not one spot that's irking her more than others to kind of focus in. That's why I'm just kind of moving it around, trying to find it. If usually we can't find it, we'll do another session just so we can get the area that's bothering her. And if there is an area that kind of bothers her more than others, then we'll focus a little bit more on that spot. Right here? Right here? I'm gonna go again just because I finally found the spot that's bothering you. Yeah, I'll hit run again. We'll keep the same settings as that was because that's what was bothering. It was a good spot. Press play.
It is a little lower.
And then we'll start a little bit lower where the discomfort was, just so we're not starting right smack dab on what's bothering her. And then we'll kind of move my way back up to where it was bothering her before. So right in here. Okay, you have 2 stickies here, okay?
Vibration can be used to desensitize the tissue a little bit, create a softer tissue to work with your Shockwave device.
So basically this kind of loosens the person up a little bit before we get to the big stuff.
Yes,
so
sir.
This is the softer approach. The hammer is over here. This allows the person to feel like maybe a little less discomfort or pain when we get to the bigger device, if you will.
Absolutely.
Now, we don't like to say this all the time, even to patients, but this creates a little bit of a damage effect, if you will. And that's a term we use with dry needling quite often. It disrupts the tissue. It challenges the tissue. It breaks it down where it's weak and challenges where it's strong, if you will. So your body has a chemical reaction in a problematic site, right?
Exactly, exactly. When we go in to remodel tissue, particularly tissue that's chronic, we need that breakdown it's a signal to the body that a remodeling process is necessary.
So Carly, I'll show you what I'm doing over here. Here's her 12th rib. This is her QL muscle. It's almost like a triangle, if you will. It runs from here to here. A lot of times there's a couple different trigger points that Travell has mapped out that we're going to work on. One's a little higher up, and there's two there in these lower branches of the muscle, okay? And so I'm going to focus on working over that area, and a lot of this is my touch, but it's more so patient tolerance and preference. So how's that pressure? Okay. Are you less scared of the device now?
Yeah,
That's good. And relatively speaking, this is going to get the person a little bit more relaxed, and I'll be able to take some tension out of the superficial portion of the muscle, and I can get a little deeper with the other device. Okay. And I already know that you can probably tolerate it a little bit more based off what she's telling me, so I'm going to increase the pressure that's occurring right now underneath the head. This is more vibration-based therapy, not the percussion of force through the skin. So I'm gonna increase a little bit. We'll get up to about 3 bar. How's that right there? The action here. So there is a magnet in here that is getting thrown forward and hitting the back of this metal piece. There's different versions of this metal piece. Some are a little bit looser and softer. Some are a little bit more firm and hard. There's a gold-plated one. We have a soft-tipped one that's for like, think of like the top of the foot, where you wouldn't want something hard hitting the top of your foot. And so I'm going to set it up over her QL muscle right here to the edge. I'm not going to go up high. I'm not going to be above any structures that I'd be concerned about. And I'm always going to angle towards a deeper tissue, a muscle or a tendon that I'm looking to change, if you will. So I want to find the spot, if you will, right? And we're going to find the tighter area that we're playing about. I'm going to increase a little bit. This is really low. This is at 1. I'm going to go up to 1.5. I'm going to check in with you. Haley, how you feeling? So you can see a little redness in the tissue. You can see where I was just holding it there for a little bit. That's totally good. Actually, I want a little bit of that over the area that we're working on. And I'm going to find the trigger point, if you will, right there. And I'm going to increase a little bit more. How's it feel? So I want to go at about, I'm going to say intensity, not pain, but intensity. A 4 or 5 out of 10. Tell me when I'm at a 4 or 5 out of 10. I like your comment about frequency and keeping it at a nice level so that there's actual some good force that penetrates a little deeper.
Yeah, typically operating in that mid-teens range.
Okay. How's that? Yeah, are you comfortable there? What intensity would that be?
No, it's not that bad.
Yeah, good. First time using it, so like as we're going through this treatment with her, like how often I'll do this is I'll space this out by a week. Here, let's do this. Do your cool editing. I'm gonna finish the treatment so I actually can talk.
Yeah.
POV face reaction video.
POV. Yeah. Yeah.
What's that feel like right there?
That, it just feels like a lot of pressure. Like it's not like, yeah. Or like, you know when you, oh my gosh, how do you describe it? I would describe this as like, if you've ever done like dynamic cupping, And like when you're like pulling it on the skin and you can feel like the skin dragging, that's what it kind of feels like.
The sensation is traveling across, that
Yeah.
deep pressure is moving across different areas.
Yeah, like right there is, yeah.
That's kind of what I feel in the knee. There's a lot of firmness underneath
Yeah.
the head of it, and I can feel the line of tension right to there, and then I feel a little pocket. To me, that feels like a trigger point if I have my thumb there. And it's kind of nice, you can feel it through the head of this.
Oh really?
Yeah, it's just firm. Firmness pushing back into me.
Yeah.
I know the anatomy of this general area. That's bone. I'm on the top of your lateral recess. There's your spinous process right here. So this is just like this is where your multifidi lift, if you will. This is where your deep spinal stabilizers are. We're way beyond the erector spinae. So I'm going right to the lateral aspect of that joint. I'd probably adjust this joint after I do this because this feels restricted to me. Like just based off what I feel.
Yeah, alleviating some of the tension from guarding will help make some of the adjustments that you might do a little bit.
No doubt about it. I need all the help I can get, Adam.
Comfort mode is on, yeah. So you're right at 1 bar now. It's gonna go up to 2.9.
Okay.
So we'll always do comfort mode. Is what Warren said, yeah. At least for now.
Is there a point to where you stop it? To where they're like, okay, that's enough?
Like if it's getting to be too intense?
Yeah. Or do you just set it to like a max mode? Like say like 1.5 instead of 4? It just goes up
Yeah, I guess
gradually?
it'll kind of be a little bit of both. So for those who can tolerate it, we'll just use the presets as is. Ultimately, it's patient feedback.
Dr. Brady isn't giving me any.
Awesome, thank you.
You did great.
So is that like a 10 out of 10?
That was getting up there. It's probably 8.5, 9.
So what are you at now?
This is probably like a 6. I'm definitely able to deal with this here.
Okay. We're going to go ahead and get you out of the
Alright,
patients.
sounds good. Alright, thanks for watching, everybody. That's how we would treat a knee sprain strain injury here at the office.